Hello there, this is Chris Langell from Market Street Financial Group and Market Street Insurance Services. I just wanted to take a few moments today and walk you through the process of shopping around for a new Medicare drug plan on Medicare's website. It's very simple to do. Takes about 10 minutes, if that. And I'm going to go ahead and walk you through the process now. Step one is going to be just to simply go to their website, which is Medicar.gov. So go ahead and type that in. And here's Medicar.gov's website. So by default, the drug plan search tool, the drug plan area will already be highlighted here. Finding plans, you'll see here. And you're just going to simply click on Compare Drug and Health Plans. So it's right on the home screen. It's one of the first options. And then you're going to enter your zip code. So 19382, Westchester. It may or may not ask you what county that you're located in. We're going to go ahead and select Chester, obviously. And it's going to lead you to step 1 of 4. So just simply answer the questions here. How do you get your Medicare coverage? We're going to, for this example, say that we're on original Medicare. A couple more questions pop up, which are optional. We're going to go ahead and just leave those unchecked for the time being. And it's going to ask you if you get any kind of financial assistance. Again, for this example, we're going to say that we don't get any help. But obviously, if you do, go ahead and select the appropriate option there. Click on Continue. And at this point, you're going to enter in your drugs. So if you have a list of your medicines in front of you, great. If not, you may or may not want to grab one just so that you have everything in front of you. But it's very simple. I don't have a list in front of me, so I'm just going to sort of wing it here and use some example medicines. Go ahead and type in, and as you start to type, it'll pre-fill for you based on the letters that you're typing in. We'll just go ahead and click on lisinopril here. Once you select your medicine, this screen will appear, which will allow you to select the appropriate dosage and frequency. So for this example, we'll just say that we take 10 milligrams per day, 1 a day for 30 days. So you take 1 a day. Click on Add Drug and Dosage. So it'll automatically add that drug to your drug list. Come back up here. Let's say you're on Lipitor as well. Click on Start typing Lipitor. It'll pre-fill. And again, go ahead and enter in the appropriate dosage and frequency. We'll leave it out on the defaults for this example. Click on Add Drug and Dosage. Let's see. I don't even know. I will just say that we'll click on this one. We'll leave these at defaults. Dosage and frequency. Click on Add. And we'll just leave it at 3 for right now, but obviously you're going to want to add all of your medicines that are prescribed to you. Also, before you continue on, what you may want to do is, if you have something to write on, write down this drug list ID number and also this password date, because if you have to come back to this list later, this will allow you to do that without having to type in all of these medicines and dosages in again. So go ahead and write down this code, this drug list ID, and also the password date in case you need to come back to this later. So go ahead and click on My Drug List is Complete. It'll take you to the pharmacy screen. You don't have to add a pharmacy, but I would recommend just doing it if there's a pharmacy that you prefer to use. You may or may not end up using that pharmacy though, depending on your situation, but go ahead and click on whatever pharmacy you used. If you don't see it listed here, then come up here to this little drop down and select the biggest 8 miles compared to 1 mile. So it's going to pull up 74 pharmacies within 8 miles of Westchester. So it gives you a wider choice of pharmacies. You can cycle through these and find which one you like to pick. So we'll just assume that we go to CVS Pharmacy here on Miles Road in Westchester. Add the pharmacy right here by clicking on that Add Pharmacy link. And as you see, it's added it right here. We're just going to go ahead and you can select more than one if you like. So add your pharmacy in and click on Continue. and it'll take you to the next screen, which is refine your plan results. Now, there's a lot to look at on this screen. Don't really pay any attention to this left sidebar here. Just sort of focus on the middle. It'll what we're going for here is the drug plans, but it also gives you the option to search for Medicare Advantage plans that include drug coverage, and also Medicare Advantage plans that do not include drug coverage. But obviously, we're here to find a drug plan, so click on prescription drug plans, which it's showing 38 plans in our zip code. So click on that and then click on continue. And it's going to show us the plan results here on this screen. So just scroll down, and there's a couple different ways to sort these out. Depends on if you want to go to a retail pharmacy or if you want to get your drugs via mail order. As you may or may not know, mail order is almost always less expensive, sometimes substantially, compared to a retail pharmacy. So for this example, we'll just pretend that we're going to get our medicine from the CVS pharmacy in Westchester. So up here it's going to say there's 38 plans in your zip code. I like to click on View 50 just so it shows all of the plans on one screen so you don't have to cycle through them. That's actually sort of a moot point though, because all you're going to do is come up to this Sort Results By drop-down box here and click on the appropriate option. So we know that we want to go get our medicine from CVS. We're going to click on lowest estimated annual retail drug cost, which by default is already selected. Now, if you wanted to get your drugs through mail order, obviously you would click on lowest estimated annual mail order drug cost. So go ahead and just leave that clicked and click on sort, and it'll go ahead and tell us what the best plan is based on those 3 medicines that you inputted. Now that it varies by your medicine. So if your neighbor's on the AARP plan and they say it's the cheapest plan, well, it might have been the cheapest plan for them based on their medicine. So make sure you're going by just your medicine costs. It'll filter out the best plan based on your medicines. So based on your medicines, this Health Net Orange option 1 is the best available plan in your area. So it'll show you here on the left the annual estimated annual cost based on retail pharmacy, the CVS pharmacy. They're estimating the annual cost to be $3,067. Now that is just an estimate. It could vary slightly, but they're going by the annual estimated cost based on your premium amount, your deductible, which this particular plan has a $310 deductible right here. It's not letting me select it, but and it's also going by your copay amount. So that annual number, that number right here, includes the monthly cost of the plan itself, the annual deductible, which this plan is $310, and then what your copay amounts are. So the copay amounts are going to vary, obviously, depending on the drugs you're on, how they're tiered and so forth. So then it's going to also, which is neat, show you the mail order cost. So as I mentioned earlier, mail order is usually less expensive. So they're estimating, again, it's an estimate, that it's $2,816 compared to $3,067 based on mail order costs. So after you've sort of sorted these, what you want to do is double check. This is important. Come over here and look at the drug coverages and restrictions area. You want to make sure, number 1, are all your drugs on the formulary. And obviously, if the price is low, that's great, but it's not going to do you a bit of good if your medicines are not covered under that plan's formulary. So with this particular plan, yes, your drugs are covered under this plan. Are there any restrictions? No. Okay, good, because we're going to click on no here just to see what this is. Now, usually when there's a restriction, it's going to be one of 3 things. They're going to require either prior authorization, they're going to either put a cap on your monthly quantity limit. So for example, some plans will only pay for 30 pills a month. So if you take 2 a month, you may or may not want that plan. And some plans require step therapy, which basically they want you to try a less expensive drug first to see if it works before they put you on the drug that you entered in there. Just sort of a cost containment mechanism there. So So with this particular plan, there are no drug restrictions, which is great. So once you've done this, you can go ahead and enroll in this plan right from their website. Very simple. You just click on enroll here. And it's going to ask you some questions here. I'm not going to go over each and every one of these, but basically it's saying, you know, you're eligible to enroll at this time if, and then any of these choices are true. So we're going to go ahead and click on continue. And we're going to just pretend as if we are new to Medicare. So we're aging into Medicare. Obviously, if that's not the case for you, you would just click on the appropriate box here. And then click continue. It will then take you to a name, date of birth, gender, address screen. You're going to enter all that information in and then click on this continue button right here. So after you click on continue, it's going to show you a screen where you're going to enter in your Medicare number. So whatever number is on your Medicare card, that will help them determine when you want this coverage to begin. And there's only a couple screens after that. It's very simple to do. You can either pay for it, you know, monthly, or you can opt to have the payments withdrawn from your Social Security if you are indeed collecting Social Security. So it takes all of 5 or 10 minutes to do this. It's very simple. I didn't go through each and every detail just because I wanted to keep this sort of short and sweet for you guys. But if you have any other questions about it, feel free to drop me a comment here on the website below this tutorial, or you can also give me a call at the office at 610-692-3200. Extension is 102. And again, this is Chris Langell for Market Street Financial Group, Market Street Insurance Services. Thank you for watching, and please feel free to contact me if you have any further questions or you'd like a free consultation to go over your options in more detail. Thank you so much.